Welcome back to Before the Scalpel. Decades of trust, one spine at a time.
So decades of trust, what does that mean? So what Powell's been, we're now in our almost 56th year.
Yeah.
And so when we look back at the thousands of patients that we've seen, many of them are still coming.
Right.
Even from the very onset. And so when we talk about trust, people wouldn't be coming if they didn't value what we did.
Right.
And so not only is it a testimony to what we do as chiropractors, that it helps keep their life functioning, keeps them healthy, but it's also a testimony to the trust they have in us to send people to us from their families and their friends.
Right.
So it's
And
huge.
Judy's a good example. She's referred friends and family,
Absolutely.
her children. So it's a unique opportunity. My dad started this place in 1970, so I was 3 years old when he started this practice. So I would be running around in the practice as a kid, and the patients that are still coming as patients from then knew me as Jimmy.
Wow.
So very commonly they'll say, "Hey, hi Jimmy,"
Yep.
and it's a unique
Yeah.
compliment to have them
Well,
trust us.
And I know not only how proud your father is, Dr. Powell Sr., but I know it makes the patients proud to see the fact that you've carried on the family business, and that's been great, and it's been a great success. And it's about serving the people, and we love them, and we take good care of them, and I couldn't imagine a better profession to be in than what we're in right now.
Me either. And perhaps my son Jonathan's about halfway through chiropractic college, and we're looking forward to him possibly coming back as a doctor here. So then there'll be 3 generations here at Powell.
Yeah, so one of the 13 grandkids got it right. So exactly. So, but yes, so many patients. Of course, Judy being a patient through the years with the regular chiropractic care.
Right.
She also came on board as one of the first to go through the Discovery program back in 2006.
Right.
So. Seeing all the care that was provided to her before then, I think it was a testimony to the fact that our office is on the cutting edge.
Yeah.
We provide the care through the years, and we find new treatment protocols, new
Technologies.
New technologies. As people come along with different problems, we find different solutions to help get them through it.
That's exactly right. Patients encourage doctors to learn new things. And as they have a problem that we're not finding the success that we were hoping to find, we go in search of that new tool for your tool bag to see if we can make a difference for that patient's life. And the disc recovery program is an exact example of that philosophy.
Most definitely. And I think that's what's been so exciting about this practice is that we've branched out. We're unique, and we find different ways. And saving people from surgery. I mean, how exciting is that?
Yeah.
And that's what the Discovery program does, and we've seen it happen countless times.
Right.
And to say that we've done it 20 years, I mean, can you believe it's been that long?
No, I can't.
Yeah. I mean, just like that. So, seeing our old patients come to new technology and then them referring people for the first time and seeing them do well has been awesome.
Right.
Yeah.
So Judy's going to give us an opportunity to share her testimony.
Yes.
And we'll be right back.
I came in with severe pain in my back and numbness going down my arm into my hands. I couldn't turn doorknobs or open jars, and a lot of pain in my neck. I was taking ibuprofen 24/7. And Dr. Powell suggested I try the DRX decompression therapy. And so I went through that program, and all my symptoms did clear up and go away. And I've done a couple of decompression treatments through the years just to refresh it, I guess. And I haven't had those issues again. Oh, you have no idea how many friends and family I've recommended to come here, and many of them have, and many of them are still patients here. I like the fact that they're a one-stop shop with Dr. Robert here as a naturopath, and they can give you the supplements and recommend things like that to help with your issues.
Judy is just a delightful patient. I've had the privilege of seeing her. She's really been more connected to you, Dr. Nall, but we've seen her kids, her husband, and she's just a delight. Just makes you laugh and smile when you see her.
Oh, absolutely. And you know, when Dr. Powell started to fade away from the practice and,
Right.
and retire a little bit, I had the opportunity to pick up on some patients because I was just starting out, and
Right.
she happened to be one of my first. And of course, I've seen many others since then, and it's been wonderful. So, giving me the opportunity, and here I am today. You know, getting ready to start 26 years in practice. I know you've been around for
Longer.
longer.
I'm
Yeah.
old.
Not old, just seasoned. That's all.
Yeah, experienced.
So, yeah, but going back to discovery and the referral process, it's interesting how many folks come here knowing what the program's already about, and even going into the examination room, these patients pretty much know that that's what they need.
Yeah.
And obviously, we have to go through the whole process to confirm that, but many times they're 100% right on target.
Right.
And that's kind of what the program has self-perpetuated, and that's what we're finding is happening more often.
And commonly we'll have patients say to us that their surgeon that they met with also says to them, try everything else first and surgery last.
Yeah.
And so when they hear that message from those surgeons and they find this program and they get success, they tell their friends and family.
Absolutely.
And that's that decade of trust stuff.
Yes. And it's a blessing to hear those words come from these patients' mouths about surgeons saying that, because you don't always hear that.
I've also heard them say there's no eraser on a scalpel, so you got to be darn sure that's what you need.
Yeah, absolutely. And that brings up a good point. For those folks that may need surgery and they come in here, and most of the time we treat them, they don't need it anymore.
Right.
But if they happen to need it, they're not going to be any worse off.
Correct.
Okay. Once you have the surgery, you can't go back from that.
Unfortunately, the surgical correction is not able to be undone.
Yes.
But there's things that can do for those post-surgical cases that still can have value for those folks with the discs above that fusion or below that fusion. The disc recovery program has been instrumental for them.
Yeah, and that's a question I oftentimes get from patients that come in and have had the process and say, are you able to treat patients that have already had surgery?
Right.
And overwhelmingly, most of the time, yes.
Yes.
There may be some cases not, but there's still some things we can do to help. Maybe not necessarily on the decompression machine itself, but chiropractically. But in most cases, depending on what's been done surgically, the decompression still can be of value.
Correct.
So it's always worth a try.
So Grandma Powell said it this way, the proof's in the pudding. So the results that we have and that we've been blessed to be able to see is what's built that trust.
Yes.
And that trust component is that referral. It's also gives evidence of what we're doing is the right system.
And I think a lot of that trust is built on the fact of a couple episodes we talked about, coming here, if we can't help you and if what we have isn't going to benefit you, we'll tell you. And we'll refer you back or get you to the next place where you really should be.
Right.
And most of the time we do that, we can still co-treat. Doesn't mean we're going to let you go.
Right.
We still work with you, but we're going to work with some other folks as well to try to get you better.
Sure. We commonly hear, I got my life back. That's something that Judy commonly has said.
Yes.
And she started here, I think, in 1978.
Yeah. Yeah.
So, I was a young kid,
Yeah.
and she was a young kid,
Yes.
and
Absolutely.
she's gotten great relief.
Right. And so that's another testimony to what chiropractic can do over time. And so it's been great. Yeah.
So next year will be 20 years with the disc recovery program and decades of trust, not just the patients that come here, but also staff.
Yes. Absolutely.
We have staff that have been here 15 plus years and have said to us, I want to retire from Powell. And that's a huge compliment.
Oh, it is. And even the staff that we'd had that worked many years with us that have retired still come back for care,
Right.
as do their families.
Right.
So the chain continues. But yeah, having somebody say that about, working here, I mean, that's the ultimate compliment as far as I'm concerned.
Agreed.
And being able to take care of their families naturally is, I mean, what better gift could you give?
You can.
Or receive.
Right.
Yeah. So, yeah, it's a good point.
Yep. So our next episode is from the other side of the table, doctors who become patients. And we look forward to sharing that with you coming up soon.
Powell Chiropractic Clinic introduces Discovery, the alternative to back surgery. The advanced Discovery protocols created in 2006 by the doctors at Powell Chiropractic Clinic are healthy and effective ways to avoid surgery and relieve pain. Innovators in chiropractic care, Dr. Jim Powell and Dr. Walter Null invite you to live pain-free, drug-free. Call today for a free no-cost consultation and preliminary examination. Powell Chiropractic Clinic, located on Munson Street Northwest in Belden Village and at powellchiropractic.com.